Enterovirus infections in babies are, oh my god, so scary! I recently admitted a 2-month-old baby who presented with 2 days history of fever, cough and flu. And the baby was admitted to hospital on day 2 of illness and received IV antibiotic and remained well and afebrile for the next 2 days. Her initial white blood cell was 7.1, platelet about 440, CRP was only 10 and the liver functions were normal. On the day 4 of illness, she developed high spiking fever, she became fussy, less active and refused feeding. We repeated combo tests which includes influenza, RSV and adenovirus and were all negative. Within 12 hours, she deteriorated further. She had persistent high fever, she became drowsy, restlessness, and clinically she shows signs of meningism whereby she has increase in reflex and also persistent ankle clonus. She developed persistent tachycardia with a heart rate of 170 to 200. She was admitted to the ICU for closer monitoring and we escalated the antibiotic to cover for bacterial meningitis. Lumbar puncture was done and the PCR shows enterovirus and human herpes 6 virus positive. She was diagnosed with enterovirus and human herpes 6 virus meningoencephalitis. Patient was unstable with compensated shock and high lactate of 3.6. The white cell count remains low, but the CRP and liver enzymes shoot out about 3 to 4-fold. And besides, she was also showing signs of early myocarditis like tachycardia and mild dilated chambers. Intravenous immunoglobulin was given right after the diagnosis was confirmed. She received a total of 2 IVIGs where she recovered rapidly. Her fever subsided and she developed rashes. And after 1 week of antibiotics, she was discharged well. So what can we learn from this case? Infants are the high-risk group. They are very fragile and deteriorate rapidly. A simple flu and cough may turn into a severe brain infection. So doctors should always be vigilant and act as fast as possible. Number 2, doctors should always build good rapport and gain confidence from parents. I was quite thankful that parents trusted me and consented for lumbar puncture. Without it, I wouldn't know what's the cause of the brain infection. Number 3, high index of suspicion. Practicing doctors should be aware with what's going on around the area. Currently in Klang Valley, we have rising cases of enterovirus infections in babies, particularly ECO11, and many babies succumb. I thank the parents for allowing me to share this experience and spread awareness. Hopefully, this is beneficial for parents and medical doctors.